Welcome back to your Miss Family. South Africa has made significant strides in addressing the HIV epidemic with the world's largest antiretroviral treatment program and our constitution that enshrines the rights of us all, regardless of our HIV status. Yet people living with the virus still face significant challenges, from stigma to discrimination to barriers in accessing healthcare and justice as well. This morning, Pulu Ramatwala joins us to discuss the intersection of HIV and human rights in South Africa. He's the Human Rights Technical Advisor at the South African National AIDS Council, or SANAC, and he's also a person who is living openly with HIV and has worked tirelessly to raise awareness and protect human rights. Pulu, good morning. It's so good to have you with us.
Good morning. Thank you for inviting me.
So you have been an inspiration to so many in sharing your story and your journey. So you found out your status when you were 19, right?
Yeah.
So that was when,
1999. So
Sure.
that was like over 25 years ago.
Oh my goodness.
I was still young, a student.
Oh, you definitely still look young.
Yeah, so it's been a journey, and I think in the context of our conversation today, when I tested positive, you couldn't even openly declare that you're living with HIV. It happened that I think the same year when I tested, I don't know if you know someone called Gugu Dlamini. She was literally stoned to death because she openly talked about her HIV status. So it was difficult. And it's been a journey for the past 25 years or so of just living with HIV and being open about it, and seeing people. I've been involved in cases where people got dismissed from work. I've been involved in cases where people were kind of kicked out of their homes. Relationships breaking up because of HIV. So there's a lot that has happened since then.
It's really heartbreaking, looking back at some of these stories and the ones that still occur today. I read an article which said that almost 40% of the world's anti-HIV pill users actually live in SA, which is some of the the biggest in the world. So it looks like public perception is changing. I mean, I remember even growing up back then in the 90s, there were protests. I remember watching protests for how the government and just the healthcare system were actually dealing with HIV. So what do you think this says now, the fact that so many South Africans have used the anti-HIV pill? What do you think this says about our public awareness and just our general perception of the disease and how we can actually deal with it?
Look, we've come a long way. So one of the things that I do is that I run these forums where people living with HIV, we get together over lunch and have a conversation.
That's lovely.
And you can have a conversation on social media, and then you can post about what you're doing. So there's quite a lot of progress, but I think as I was thinking about this interview this morning, I realized that there's actually two groups. There are people who talk openly about their status, who are more comfortable, who are not scared of stigma or experiencing stigma because they can handle it. Then you've got the other population, those who are still scared, who don't have the right information about their rights, who don't have the right information about what I call positive living, and those are the people that I think we should be talking to more, to be able to reach out to them and say, look, there's life beyond HIV, there's life, there's things that you can still do, and you are still a human being who has rights in every way possible.
And you are such a great example of that. I'd imagine even for key populations like women, children, those living in poverty, the LGBTQIA plus community, it must add that an extra layer of difficulty in actually dealing with the positive status. If we look at the human rights landscape when dealing with HIV/AIDS within our country, what are some of the key rights and policies that exist, and how effective are they in actually protecting the rights of those that are HIV positive?
I've been thinking about this since last night. The main ones, it's the right to dignity. You've got the Bill of Rights that whether you are living with HIV, whether you are a LGBTQ person, or whether you are a sex worker, you have the same rights. And the right to dignity, the right to access health, the right to privacy, all those rights we all, the Constitution and the Bill of Rights, to be specific, protect us. In practice, is it happening? It depends. And part of my work, where I work at SANAC, as a human rights advisor, we mostly work with what we call key populations, people who are vulnerable. And we find that most of them, people who are, I use an example of sex workers or LGBTQIs. These are the people who are still experiencing quite a lot of stigma in different contexts. if I can give you an example, a couple of weeks ago, I went to Velcom, and there was a case where people, were killed and then dumped, at the mine because,
Sure.
and as you listen to the stories, you realize that there's the element of stigma and discrimination and lack of understanding when it comes to basic human rights, that we all have rights. People experience stigma and discrimination in health facilities, we have this program it's called community-led monitoring, where key populations, people living with HIV, go to health facilities and document experiences, whether it's a healthcare worker, whether it's a security guard at the gate who are discriminating against them, stigmatizing against them, to say, how do we deal with this? And it's the people living with HIV who are comfortable in talking about their status, who are leading the fight.
Yes.
But as I've said, you still have another group, a community where people are still scared to talk about their status, and purely because of stigma. Yeah.
Let's talk about healthcare. You just mentioned the healthcare. What
Yeah.
are the healthcare rights of those living with HIV/AIDS, and what responsibilities do healthcare workers actually have when it comes to treatment and awareness as well?
Look, firstly, the healthcare workers, they have an obligation to provide health services to anybody who needs that service. You've got the right to privacy when you are there, so nobody can come and shout that, oh, you're here for your HIV treatment, or things like that. People have got the right to dignity. So those are the rights that everyone is enshrined. They're enshrined in the Constitution.
Yes.
That we are all supposed to be receiving them. And it's not just health facilities, even police stations. Even in cars. So that every platform or area where we receive services, those rights apply. Privacy, dignity, access to health, safety and security. Those rights are important, and we should be getting them.
Just on the topic of the stigma and the discrimination that still continues, where are we getting this wrong, and what still needs to change societally for us? Because in order to protect these rights, the right to dignity, the right not to be discriminated against, what needs to happen in terms of just changing public perception and actually educating us about HIV/AIDS?
There are two things that I can think of. There's what we call internalized stigma. Most people who are living, not most, but there are some people who are living with HIV who feel ashamed, feel that they did something wrong. And most of, some of them, when they start experiencing this internalized stigma, they don't want to do anything about, their health. They're scared to go to clinics. They are scared to go to, public places to socialize. And then that links to externalized stigma, which is what, people, stigmatize against others. And when that happens, you're making it difficult for somebody who wants to, if I want to tell you that I'm living with HIV, or I just tested positive, but you always joke about, those people with AIDS. I'm just using an extreme example. Then I'm not going to tell you.
Yes.
Even if you're a family member, you're creating a barrier. So that's where we're getting it wrong. I think those who are affected, it's important to be part of communities of people who can guide you, can support you. But for those who are still ignorant about stigma, HIV, learn more. Because you could be sitting you could be sitting next to somebody as we finish this interview who's living with HIV, who's scared to tell you, and they are very close to you, and they're important to you, but they can't tell you because of how you express yourself when it comes to people living with HIV.
I think that's such a powerful statement that you've made there. Thank you very much, Pullo. After the break, we are going to jump into the disclosure rights when it comes to HIV/AIDS. Make sure not to miss that, TMS family. It's such an important and insightful conversation, and we are just getting started. There's still so much more to come here on The Morning Show. Stay with us. We'll be back after the break.